And today we have the pleasure of introducing to you Dr. Brittany Peters. She's a licensed clinical social worker who carries a certification in addictions. She's also owner of her own private practice called Centers for Wellness and Clinical Development. Welcome to the show, Dr. Brittany.
Thank you for having me. It is a pleasure. I am honored to be on your show. So thank you.
Well, I'm so grateful that we had the opportunity to review the important article that you wrote in the Weekly Challenger that really moved me, and is the reason why we reached out to you. And I think that you can speak to some of the issues that are affecting us. One of the things that we have a tendency to do is we tend to have a tendency not to deal with our mental health aspects and how that is important. And during this COVID-19 occurrence, I want to talk to you about that and just some of your observations on how we can deal with that and come through this, not as harmed as necessary.
Absolutely. I think that with the closures during this time, during COVID-19, the expectation of quarantine, the expectation of social distancing, it really plays into an ability for an individual to be triggered mental health wise. You have to remember that there are additional stressors during this time. People are not working. Individuals in the service industry may not be working. That's hairdressers, that's barbers, that's servers. And some places are laying off or furloughing their employees, which also creates an additional stress because financially individuals may have been living check to check or may not have had money saved up. And then that is further complicated by children being out of school and being home and the expectation of homeschooling as well. And so there is a lot that's going on right now that is of concern to a lot of behavioral health specialists and clinicians at this time.
Well, when we look at this situation and we examine it, communities of color have always suffered and seen that the one thing that we always have the highest numbers in, we're first in all of the health indices that have been indicated. And so now when we look at that as a totality, I mean, what are some of the coping mechanisms that we can put into place to help us get through this crisis?
Absolutely. So coping skills are essential to getting through this, but coping skills are something that individuals need in order to progress through life's challenges in any time frame of their life. And so some of the coping skills that are going to be important during this time is making sure that you're getting out of the house, although the expectation is that you socially distance yourself. The expectation is not that you socially isolate yourself. That can be very dangerous. And so you want to make sure that you're getting out into the sunlight, whether that be going for a long drive, going for a walk, walking your dog for a little extra time, getting out and stretching. Reading is really good during this time. You can also spend some time using the web-based platforms. People have been getting really creative with this. You can use Zoom platforms or FaceTime to do group meetings, do virtual yoga. I've seen people doing workout sessions. Some people are doing dinners with their family members, attending virtual church services. So you can still access a lot of the natural supports that you have in your life during this time, but it's important to make sure that you also stick with a routine as far as coping. Just to make sure that you're able to get adequate sleep is also very important.
One of the notions I want to push back against, because in conversations with some people, they don't want to admit that they might be having a little suffering from depression or anxiety because of the shame factor. Some people are trying to equate mental health to like HIV, like, you don't want anybody to know that you have it and stuff. And so I want people to understand that it's normal to have some type of anxiety during the situation, and it's nothing to be ashamed of, Dr. Brittany, to get help.
Absolutely. I think that one of the struggles we have in the African American community is that we have been able to push through. And so we've pushed through for so long, we've not really looked at the damage that has done to us, right? So there have been historical traumas with slavery. There's community adverse community experiences such as police shootings. There's adverse childhood experiences. So that is individuals who are growing up in homes where their parents have mental health or their parents are experiencing intimate partner violence. And so with all of that, the research has shown that that absolutely plays a factor in our overall health. People develop high blood pressure and diabetes and heart disease. And so those stressors play on our bodies, and it wears and tears our system emotionally, and also our fight or flight system. And so what's happening for individuals is that we have to learn to get help. But if there's a stigma, we tend not to get help, or we tend in our community to say, you know what, we're strong, we're Black, and so we're able to push through. And I think it's very important that we acknowledge that we also experience mental health, whether it be depression or anxiety, and that it's not normal to constantly live in a state of depression or live in a state of anxiety. And it's okay to get help. You can also, access your spirituality through church, but it's also important to do that in conjunction with talk therapy or medications if it's warranted.